If you or a loved one are struggling with type 2 diabetes, you should visit the link in the description below. This clinically proven, drug-free program lowers blood sugar to a normal level and can completely reverse type 2 diabetes within just a few weeks. Here's today's video.
The question, how can diabetes be diagnosed early? Answer by Prediabetes. You may undergo following blood test for the diagnosis of diabetes. Fasting blood glucose. A blood sample will be taken after an overnight fast for 8 to 10 hours. A fasting blood glucose levels less than 100 mg/dl is normal. 100 to 125 mg/dl is prediabetes, and more than 125 mg/dl is considered as diabetes. Postprandial blood glucose, 75 or 100 of glucose is taken orally. A blood sample is taken 2 hours after ingesting the glucose. A ppbg level of less than 140 mg/dl is normal. 140 to 199 mg/dl is prediabetes, and more than 200 mg/dl is diabetes. Glycated hemoglobin test, A1C. This test indicates average blood sugar level for the past 3 months. A1C of less than 5.7% is normal. A1C of 5.7% to 6.4% is prediabetes, and more than 6.5% is diabetes. You can check more at different ways of testing blood glucose levels. Answer by Ahmed Beldi. There are approximately 8.1 million people who are affected and undiagnosed with diabetes, and they don't have any idea about it. This comprises about 27.8% of the population. On the other hand, about 21 million people are already diagnosed with this disease. An infected person may show symptoms that differ from the other patient. This means that diabetes symptoms differ from one person to another. Diabetes is a manageable disease if it's identified earlier for the betterment of your health. It's way better to get informed. This helps you to keep on the watch out of those signs and symptoms that define diabetes, particularly if you fall under these categories. Symptoms of diabetes. Consult a physician if you ever experience these common symptoms that can easily define you to be a diabetic. The earlier it is for the betterment of your health. Polyuria. Polyuria is as a result of excessive intake of drinks, especially fluids, i.e., water. This results to large production of urine and frequent urination. Kidneys absorb in water from cells and tissues in order to dilute the excessive sugar levels in your bloodstream. This comes about as a result of presence of high levels of sugar present in your bloodstream. When filtering blood to produce urine, the kidneys reabsorb sugar into the bloodstream, but this is not the case to polyuria. In polyuria, the kidney fails to absorb all the sugar and glucose into the bloodstream, so the excess glucose in the blood ends being deposited in the urine, where the body is forced to draw excessive amount of water from the tissues, resulting to unusually large productions of urine. The cells keep on pumping water to bloodstream to help keep sugar levels on check. The normal daily urine output for ladies is around 1 to 2 liters, but for those affected by polyuria usually pass more than 3 liters a day. It's difficult to measure yourself, so if you find yourself visiting a bathroom more often than you are spending a lot of time in there, then count yourself a patient. Prediabetes is linked to excessive urination. This condition of excessive thirstiness is considered as one of the early symptoms of diabetes. This condition is as a result of your body failing to use blood sugar and process it. When the body fails to make use of blood sugar, i.e., process the glucose, then the latter gets abnormally high. The increase of blood sugar level in your body results to thirst, leading to excessive drinkage of fluids. Most of the people affected by this condition term this thirst as unquenchable. Avoid drinking fluids that contain sugar, e.g., soda or juice. These fluids contain high levels of sugar, which will push on the levels of sugar in your body higher, leading to excessive thirst so as to flush out those sugars. Extreme fatigue. Your body needs energy to perform its functions properly. It derives its energy from sugar, which comes from foods that we intake, especially those foods that contain carbohydrates and proteins. Pancreas produces insulin that allows your body to utilize sugar coming from carbohydrates in the food we domain. Strategist helps to keep your blood sugar either from getting extremely high, i.e., hyperglycemia, or very low. Insulin is usually defined as the key to which it unlocks cells to receive sugar and be used as energy. If you are diabetic, it means that your body is not producing enough insulin for your body, or your cells have developed resistance to the insulin's effect. This makes the cells to yearn for sugar to perform their functions, which leads to fatigueness. Polyphagia. Polyphagia is a term used to describe excessive hunger or increased appetite. It's caused by blood sugar remaining abnormally higher. Sugar can't enter the cells as a result of insulin resistance or as a result of no production of insulin A. All this then triggers hunger hormones to send impulses to the brain that tell the brain you are hungry, leading to excessive eating. With excessive eating you will skyrocket blood sugars in your body. It's better to exercise rather than overeating. Neuropathy is a feeling of numbness, tingling, in the extremes. It is a nerve disorder as a result of diabetes. It is a symptom of diabetes that grows progressively as time goes by, since excess sugar does damage the nerves. Regular checking of sugar levels within standard range helps to alleviate any further damages to the nerves. Slow healing of wounds. Blood circulation is often affected when sugar levels are extremely high in the blood. When you are diabetes, it's very important to treat wounds and cuts as soon as possible. High levels of blood glucose as a result of diabetes, with time, leads to poor circulation of blood, making it hard for the blood to reach affected areas for skin repair. This leads to the wounds to remain open and unhealed for months, leading to fungal infections. Wounds failing to heal are a sure sign of diabetes. Blurred vision. Blurred vision is one of the symptoms of diabetes. It can be caused by high levels of blood sugar. It occurs when fluids are pulled out of your lenses in order to dilute the excess amounts of glucose in the bloodstream. This makes the lenses to completely dry, making the eye to be unable to focus, resulting to blurred visions. This condition can be alleviated by visiting a physician in time to have the eyes checked, and if it's severe it can be operated. Less common symptoms of diabetes. These symptoms do not usually define diabetes, but it's worth having this knowledge since not everybody experiences those detailed symptoms. Answer by Alicia Carter. Prediabetes is a condition when someone has higher than average blood glucose levels that aren't quite high enough to be diagnosed with type 2 diabetes. It is thought at least 1.7 million Australians have it. But what are those levels? What is considered a higher than average? Recently published research in the British Medical Journal looked into assessing cutoff levels for prediabetes diagnosis, as there is considerable difference between guidelines around the globe for the lower cutoff point. Diabetes is diagnosed when blood HbA1c levels are raised, or either or both. Impaired fasting glucose or impaired glucose tolerance are found. Low blood glucose is not high enough for a type 2 diabetes diagnosis. In Australia, impaired fasting glucose is diagnosed when fasting glucose is between 6.1 to 7 millimoles/L and blood glucose is less than 7.8 millimoles/L 2 hours after consuming a glucose drink. Impaired glucose tolerance is diagnosed when blood glucose is between 7.8 to 11 millimoles/L 2 hours after consuming a glucose drink. This is in line with the World Health Organization (WHO) guidelines. However, though the impaired glucose tolerance range remains the same, the American Diabetes Association recommends a lower fasting blood glucose cutoff of 5.6 to 6.9 millimoles/L. But would a defining lower range be helpful in managing the high blood glucose levels before they climb even higher? Left untreated, prediabetes can easily progress, and it is thought 70% of pre-diabetic individuals will eventually develop type 2 diabetes. In addition, the research published in the British Medical Journal found prediabetes was associated with greater risk of cardiovascular disease and all-cause mortality. This is in people with fasting blood glucose as low 5.6 millimoles/L. This is the lower cutoff point as per the American Diabetes Association, but not the WHO or in Australia. Raised HbA1c was also associated with increased risk for cardiovascular disease and coronary artery disease. The importance of all this, you see, is the earlier the diagnosis, the easier it is to reverse the condition or curb development into full-blown type 2 diabetes. Risk factors for prediabetes include poor diet, smoking, low physical activity, being overweight, stress, history of gestational diabetes, and family history of diabetes, and some cultures are more sensitive to developing insulin resistance. Yet, 40 to 70% of cases of prediabetes can be reversed with diet and lifestyle amendments.